Hey, what's up everybody, it's OC. I've been getting a lot of people telling me, oh, don't worry about it, it's not that bad, it's not going to be like that here. And you know what? You're right. It's not going to be like it is there. For one, a lot of our population owns guns. They're not going to let people just come into their homes and order them to those concentration-like type camps that they're holding these people in. When the virus finally starts to outbreak here, there's going to be a lot more problems here than there were in China. But I'm done telling you. I'm going to let someone tell you who knows a whole lot more than me. So check this out, and please share the information. We can make a difference, but we must speak up.
China's state-run media has been given constant update and a lot of coverage of the coronavirus epidemic, but they are all in one tone.
仅用了3天时间就完成了改建17工程。
非常感谢党和政府。
非常有信心，这场战争而且是必胜。
Social media, however, depicts a very different picture.
现在我数一下啊，时代，1、2、3、4、5、6。
到现在早餐也没有，医生也没有。
3具尸体已经在这里躺了一个上午。
现在每天的运输量和火化量是平时的4到5倍。相信咱们这些狗官。
The CDC take into consideration the official number from the Chinese CDC might still be very severely underestimated. Welcome to Zooming In, I'm Simone Gao. On February 12th, Hubei health authorities announced an additional 14,840 cases of the coronavirus. It marks the largest single-day rise since the epidemic began, and it's almost 10 times the number of cases from the day before. Health authorities said the spike was due to the inclusion of clinically diagnosed cases in Hubei. Others suspect the true reason is because of a recent change in top leadership in Hubei province and Wuhan city, as these two Xi Jinping appointees seek to avoid taking responsibility for their predecessors' incompetence and concealment of the epidemic. To decode these events, Zooming In did a thorough case study of one of China's most popular media outlets' coverage of the coronavirus epidemic. We also did a preliminary calculation of the infected population and death toll in Wuhan based on the investigation by the Epic Media Group into one of Wuhan's funeral homes. From there, we'll explore the truth of the epidemic, how Chinese leadership view it, their plan going forward, and most importantly, what it means for you if the epidemic in China is 10 times worse than reported. China's Central Propaganda Department said on Tuesday, February 4th, that it would dispatch more than 300 journalists to Hubei province and Wuhan to report on the disease. The decision came on the heels of a meeting chaired by Chinese Communist Party leader Xi Jinping held earlier this week amid mounting public anger from social media at the government's handling of the crisis. During the meeting, Xi emphasized the importance of enhancing the regime's control over online media. He directed that the media should tell moving stories of how people on the front line are fighting the virus to showcase the unity of the Chinese people. China's state-run news media started extensive campaigns immediately after Xi's remarks. On February 4th, Hunan Television, one of China's most popular cable TV channels, aired a 2-hour live broadcast with updates on the coronavirus epidemic. Spanned across 30 or so segments, the reports all take the same tone. We gave you a condensed version of what essentially that narrative is. China's National Health Commission released the latest update on the coronavirus. The number of recovered patients rose to 262. 4,955 patients were recently discharged from medical observation. No new reported deaths. Thanks to scientifically effective treatment, 3 patients have recovered. Laudi's second medical zone was constructed in only 3 days. My confidence in the victory has surpassed my worries. Hunan pharmaceutical manufacturers resumed work to guarantee speedy and steady supply. Xiangdi Technology rushes back to work, produces 20 automated nucleic acid extraction instruments per day. Changsha Province, vegetable supply is more than enough, 8,000 tons of transactions per day. Despite high demand due to the virus outbreak, market prices remain relatively stable. Governor Du Jiahao visited railway stations to review their work. As long as we follow President Xi's lead and guidance from the central government, victory will be ours. Hunan Wangwang Hospital. Homemade disinfectant offered to neighborhoods free of charge. Also interspersed throughout the report were music videos eulogizing good deeds under the guidance of the party. Western audiences might find it ridiculous, but sadly, this has become a social norm in China whenever the government tries to deal with a public crisis. But is the propaganda effective? I asked the microbiologist and China expert Dr. Lin Xiaoxu. Do you think the Chinese government has been very effective in shaping public opinion?
I think actually the public opinion was heavily influenced, shaped by the Chinese government's propaganda tactic, because to the Chinese government, it's very clear, even from Xi Jinping's directive, it's very clear the government put propaganda purpose on top of rescuing people. And Chinese government control all the media resources. So when people are being quarantined down at home or in hospitals, if all they watch just the government's official tone, all the so-called positive energy, then more people will become delusional.
Coming up, social media tells a completely different story of Wuhan. The real death toll might be 8 to 10 times higher than the official number. While we do not attempt to undermine any efforts of the medical staff working on the front line, it is worth questioning what Chinese state-run media do not address and why. In fact, in contrast to China's official media, social media outside China that Chinese people have to circumvent the firewall to use depicts a very different picture. We selected the most credible ones with clear visuals that are self-explanatory. The Huoshenshan Hospital is one of 2 massive hospitals China's built to treat confirmed coronavirus patients with severe symptoms. According to China's official media, it is well-equipped and patient-friendly. But a construction worker's video reveals a different story, one that CCTV footage doesn't show. Each room has a tiny window for food delivery. Iron railings are installed on all windows. Doors can only be opened from the outside. People in the rooms cannot leave. The camera person proclaimed, "This is not a hospital. It is a concentration camp." Fangcang hospitals are the massive quarantine centers in Wuhan. Patients there show grievous footage of the center.
这就是所有的人，全部都睡在这个地方，根本都没有隔离。一个隔离间都没有，这么多人，你说要洗漱，要上厕所，到现在早餐也没有，医生也没有。
The Wuhan government released a notice about quarantining 4 types of people, which are people confirmed to have coronavirus, those suspected to have the virus, people with fevers who cannot be ruled out for having the virus, and those who have had close contact with people with confirmed cases. The way and the extent the Chinese authorities enforce the quarantine measures are appalling. In some communities, local officials ordered the lockdown of infected people's homes. That is, to seal their doors and windows so they can't get out. Another type of video circulating on social media is footage of dead bodies in hospitals and dead bodies being taken away. The underlying question is, if we see death everywhere, does that mean the death toll might be much higher than we know?
3具尸体已经在这里躺了1个上午了，有的人已经是凌晨死的，到现在没有人来处理。然后医生、护士还有病人全部都在这种环境下面工作。这就是定点医院的现状，没有任何人管。
哇，里面还有好多尸体嘞，妈妈！妈妈，里面好多尸体。
看到了，看到了。
那个车里面，车里面。
看到了，我妈妈看到了。2个有很多。
亲身经历啊，亲身经历，这么高的，这么高啊！
刚才3个，现在我数一下啊，4袋，1、2、3、4、5、6、7、8，有8个。哎呦，这么多，就那死了。这是几天？就昨天是吧？哎呦，这死人这么多啊！这是病房不让我进的，他在往这搬尸体呢，往这搬尸体。这里面还有枕石，也有枕石。哎呦，这里面也有枕石。哎呀，对不起。哎呦，这你家什么人呢？父亲。哎呦，我的父亲。哎呦，你这一个100米的，我的兄弟。完全是啊是。完了。我家的。完了，估计不上来了，已经没有生命特征。不说了，交了。没有生命特征了没？这个又完了，这个完了，这个又完了呀，这个又完了一个。又完那个，他儿子啊，又快死了一个，他儿子已经喘不过气来了，那个刚才3个，现在几分钟？5分钟了，现在已经8个了，又来了一个，来2个。怎么还有？里面还有尸体吗？还有啊，这么多！哎呦，这家伙这也太多了呀，这样还在搬，这尸体还在搬。哎呦，8个尸体。
The most alarming evidence is a phone call Epic Media Group's undercover investigator made to one of the crematoriums in Wuhan on February 4th. The conversation shows a simple yet heart-wrenching fact. The math simply doesn't add up. The actual number of bodies being cremated doesn't match the government figure by a large margin. Here's the highlight of that phone call.
就是目前的工作量，你们现在感觉到怎么样？还可以完成，对吧？如果再增加，
压力很大。
压力很大。
压力很大。领导，你要是听真话还是要听假话？
当然要说实话了。我们
实话我就跟领导说，我现在我本人都要快崩溃了。
哦，你讲讲看，为什么？
我现在压力非常大。
那为什么呢？你们现在的
我上级重视这个问题，现在的重心都在医院这块。
对。
我们这块被人遗忘了。我们现在每天的运气量和火化量是平时的4到5倍。我们的人员从春节前到现在，人头上没有休息。
就是。
而且还得不到人员的补充。
那你现在说4到5倍是一天，像昨天你有多少？
我这个数字我不好跟你说，因为我不知道你的真实身份。你光一个电话，我这个按照上级的要求，这个数字不许随便说。因为我刚才已经跟你讲了，现在的业务量是平时的4到5倍。
4到5倍。那你这个业务量是从什么开始？你是从什么时候开始有这么紧张的？
从腊月的29，这个数量就不断在上升。
你说的就是说
已经达到最高峰，腊月29应该是元月23吧，23还是22号开始人数就感觉不对头了，这个人数就上升了，有点猛了。
那你们现在是这个每天是3班倒吗？
不叫3班倒，领导，哪有人3班倒啊？我现在能够排2班倒都不错了。
哎呦，
我在这个地方已经是每天能够睡上2、3个小时，已经是很幸福的了。
哎呦，那是你们辛苦了。那现在你看，如果说给你们增加人员的话，需要多少人可以满足目前的这个量？
增加人员。如果按照昨天的那个量的话，至少要给我增加40到50个人。
40到50个人。那你们现在有多少人？
我现在有110多人。
110多人。你们一共有多少个炉子？
我的炉子设备共有18台，但是能够使用的只有11台。
11台。
能够使用的只有11台。
那你这一个
为什么只有11台？就是他妈的一帮人期待我本来招标搞的，最后呢让一帮他妈的反腐差点我们坚决支持，但是不能他妈的那一帮人无视是妈的这是算了，我不想跟你多说了。
你这样
搞到我们设备没有。我们基层那底下难了。
那你那些11台可以工作，那是不能工作的是坏了吗？还能不能修？
有的坏了。有的是完全不能修了。前天好不容易通过市指挥部从外地找了2个维修工过来，你知道现在封城。
我跟你说，我马上派人来给你维修炉子。你现在是需要什么？我问你，你现在需要什么？除了需要人40几个人，还有什么？
需要人。我现在就差人，我的人太疲倦了，太疲乏了。完全得不到休息。你刚才还说3班倒，我现在2班倒都做不到了。
哎呦，那你这2班倒24小时，那就一班就得要10几个小时啊。
我的人员都没回家了，领导啊。
哎呦，那你现在一个人一个炉子要几个人看？是一个人看就行了吗？
我一个人要管几台炉子。我火化工加上维修的总共才是12个人。
那你刚才不是说你有100多个人吗
？100多人，还有些女同志。我现在车队那边，我9台车，每台车配4个人，2班倒。领导你算算，我全管的男同志全部去接运尸体了。
那你一台车能当？
同志都去搞调度、接电话、消毒。
那你一台车一次能拉几个人啊？
以前一台车拉1个人的。
现在呢？
我们现在把里面的格子那些东西给拆掉了，最少拉2个。然后把我的那个以前不是殡葬车的中巴车，把椅子卸掉，一次拉7、8个。
这样的话，那你11台炉子那你这11台炉子那是少了一点。那1台炉子，那处理一个尸体需要多少时间啊？50分钟。50分钟。那能不能缩到半个小时？这个能不能缩短？
说不了。
那你有些地方说是45分钟，40多分钟就可以了吗？
那我不知道人家的设备是怎么回事。
你们的50分钟。
烧到50分钟。
对，50分钟，那也是够忙的了。哎呀，那你这个真是够忙的了。
我不是说我都要崩溃了，就是这样。
那你原来正常的情况下， 不需要晚上值夜班的嘛，对不对？
以前按照武汉市的习俗，12点钟以前要落帐，所以说我们都是从一大清早上6点多钟开始上班，
对，
火化，到中午就不干了。
哦，对。
现在的情况是怎么样？我告诉领导，遗体接运起来立即火化不停。
哎呀，那真是现在够忙。还有一个，那你现在每天能不能现在拉来的能不能完成？有没有积压下来放到第2天做的？
火化的积压的这个情况还不是太严重。主要是那个遗体在医院的，我们接运不及时。
哦，就是车少。
后来那个什么，我们武汉市的狗屁书记马国强，还说什么让我们在1个半小时把遗体拉完，拉得了吗？让他书记去那拉一下试一下。
哎呀，那是因为
狗屁官僚主义。
那至少这个你们书记应该。
现在给我们下指标，要纪委的督查我们。医院病人死了以后，要我们1个半小时以内把遗体拉走。
对，那是。
能做得到吗？
那你叫他派车来啊！你叫他派车拉过来嘛，你们负责烧嘛。
我们没人要车没车。
那你叫那个书记，你说你给我拉个人过来。
是书记。我们现在主要是人力的问题，车给我增加这3、4辆都可以了，我的人现在受不了了。
人给你增加40、50个人。
1小时，人不停的去搬运接人。
哎呦！
我们现在所有的人去男同志全部投上去了，只要人他妈的人动的都上去了。
对呀，你知道他们其他几个殡仪馆情况怎么样？
只会比我差，不会比我好。
哦，你跟他有沟通吗？
有沟通啊。
你最近跟哪个殡仪馆沟通过啊？
我跟汉口殡仪馆沟通过，他现在的业务量比我还大，他的压力比我还大。
除了这个医院之外，有没有这个就是社区直接给你们拉来的？有些倒在路上的，他就不一定去医院了，对不对？
有。前几天我做了个统计数据。我们最近这个就是前几天数据啊。数据不代表这几天。这几天医院的就医情况有所改善。前几天我做了个统计。38%是医院接来的。61%是在家里死亡的。所以说这个就医的情况很不好，前几天。
对。
你想想，60%都在家里死的。
哎呀。
当然，这个家里死的不一定是这个肺炎啊，也其他我说的这个数字没有区分肺炎和非肺炎的。
现在大部分都是。
武汉市这帮狗官把这个城市管理的一塌糊涂。
The investigator called the funeral home again shortly afterwards and got this figure.
跟你负责任的说，昨天是我们最多的一天。
昨天是多少？你能不能告诉我一下？他说40多个，不到50个，是不是这样的？
我就姑且相信你一下。
你说。
我昨天总共接运的遗体，127个。烧掉了116个。
OK。
然后确诊数，确诊数是8个。我戳的这127个中间，根据死亡证书上面标明的确诊的8个，写的疑似的，是48个。我这是全部有死亡证书在我手上的。
好。
According to China's official records, 131 people are expected to die in Wuhan every day. Wuhan has 7 funeral homes, and they can cremate 135 bodies daily on average. Based on this information, Zooming In did a preliminary calculation. We concluded that since January 25th, 2020, when the funeral workers said the number of bodies arriving at the funeral home started to rise, roughly 470 people died of coronavirus every day in Wuhan. From January 25th to February 12th, over 8,000 people could have died from the disease in the city. On February 12th, the Epoch Times reported that funeral service teams from multiple provinces were going to Wuhan to help transport and cremate corpses. These teams held ceremonies before leaving, where they held up banners that indicated where they were from and what their mission was in Wuhan. At the Center for Disease Control and Prevention press briefing at the National Press Club in Washington, D.C. on February 11th, I asked the CDC Principal Deputy Director, Dr. Ann Shackett, these questions. Simone Gao was zooming in at NTD TV. Some of the people have already touched upon this, but I just want to dig a little deeper. So when CDC make assessment of the epidemic, does it take into consideration that the official number from the Chinese CDC might still be very severely underestimated? Because, for example, the Chinese medical officials admitted that medical personnel admitted that the diagnostic kits they need to use to test the patients are very limited, only 10% of what they actually needed. And also we did an interview with one of the funeral homes in Wuhan City two days ago, and they said they have been absolutely overwhelmed. And they've been basically working 24/7, and 60% of the bodies they cremate are actually from home. 30% from hospitals. Obviously, those 60% of the bodies are not counted in the official number. So that's one question. I mean, is it still very, very severely underestimated? And question number two is regarding the quarantine center in China. We know China has this policy right now. If you have a symptom, it doesn't matter if you get a flu or anything else or coronavirus, you are forced to those quarantine centers. We have seen footages of this Fangchang quarantine center with 1,000 beds, like very close to each other. So my question is whether those will actually increase the possibility of cross-infection, or is it an effective way to control the spread of the epidemic? Thank you.
Yeah, thanks. Those are both really, really important questions. We absolutely assume that the reported cases are an underestimate. The early exportation of virus to a number of countries was used by mathematical modelers to estimate what the total cases must be. If we knew of 41 cases, but this many countries were seeing cases imported among travelers using the known numbers that travel, there were some estimates of under-reporting. And, it's a mix of not hiding cases, but really trying to keep up either with the mild cases or, as you say, now that the disease is so common that the laboratory capacity can't keep up, or the kits aren't, there's not available kits. So we absolutely assume there's a much greater number of cases. And China's actually reporting what they call suspected cases, ones that haven't yet been tested. And then that's typically, how we assess outbreaks and emerging infections. Your question about the quarantine center, theoretically a quarantine center should be people who have no symptoms, who are being observed to see, because you think they're higher risk than others because they've been exposed, you want to observe them, and at the first sign of symptoms, you want to move them out of exposure to anyone else so that they can be isolated. The concern about putting people who may be ill together could be a problem in terms of acquiring the infection. People who go in for something else like influenza or measles and then come down with the novel coronavirus. So that's why the circumstances of isolation are so critical. It's one of the reasons I believe that China built those hospitals with individual rooms so that they could keep people they knew were sick separate from others and safely care for them. But the ability to surge for a very large-scale outbreak can be challenging for anyone.
I also asked Dr. Lin Xiaoxu what it means for the rest of the world if the coronavirus epidemic in China is actually much worse than the Chinese authorities lead us to believe.
So that's why, from this simple calculation, we can tell the situation is at least 10 times worse than the government exposed to the world. So that's why we really worry about the situation in Wuhan. And because this disease already spreading to so many countries, people always worry that it would turn into a full-blown pandemic. So right now, outside China, we just didn't see any country have a major, like a cluster case outbreak, and only smaller community groups or individual cases. So that's why the WHO didn't call it a pandemic yet. But it definitely has this potential to develop into a full-blown pandemic, especially if the Chinese government conceal the information and we know more than probably 10 times more people got infected. So definitely more people are still being infected. More people can travel to different places inside China, and more people maybe even go to other countries. So that's why these data shows the potential for these outbreaks to develop into a full-blown pandemic is much higher than the world knows.
But this is in China. Even if the situation is much worse than we know, would it pose imminent danger to the rest of the world, considering Wuhan and Hubei province are basically locked down, and many countries have implemented travel bans for Chinese nationals?
I think actually the whole world need to be very cautious about this outbreak because in many countries that are bordering with China, for example, Vietnam's, Turkestan's, and even Afghanistan, many of these countries, they don't have a good public health systems. So many of the countries around the world, not like United States or UK or other well-established, well-developed countries. And so those countries, if you got some people infected, some imported case from China, then it's a whole big disaster for the region. So, even for Latin America, so many Chinese people may travel to Latin America too. For Africa, for example, Cairo is one of the biggest airports that will receive many Chinese people. And many of these countries did not completely close down their airlines flying in and out of China, right? So that's why it's still a huge risk for the whole world. If any of the developing countries got a severe cluster case happened in their countries for this Wuhan novel coronavirus infection, then in these countries it could quickly turn into an epidemic, and it can spread in a very uncontrollable fashion.
As far as I know, the Chinese authorities have not allowed U.S. officials to go with the WHO staff into China to investigate the epidemic. Why do you think they won't allow U.S. experts to go?
I think fundamentally because Chinese government still regarding the public health crisis as a state secret, and they still think the top priority for the Chinese Communist Party is to keep the so-called social stabilities. So they keep broadcasting these, they call it positive energies, telling the world, telling Chinese people they are doing great. They can lock down the city, they can build a hospital in 10 days. So many positive measures have been taken to contain the situation. But they don't want the whole world to know how much people suffer in this kind of quarantine down situations. And are there any loophole in the prevention measures? Are there any loophole in their supplying, for people's in the self-quarantine situations, and how many people die due to the humanitarian disaster that the government may created, and they may not want the whole world to know the true origin of this virus. So there are many questions regarding these, many issues maybe the Chinese government didn't want the whole world to know. That's why they keep rejecting the U.S. Infectious disease experts or disease prevention experts to go into China to investigate this situation. But I think the whole world should actually demand stronger to conduct independent investigation, or at least joint investigation.
But why do they allow other experts from WHO into China?
Okay, that's because WHO is basically a political organization, and even though it serves the public health purpose, but its leadership has a close tie with Chinese government, and also its mandate only asks the WHO to work with the government agency or government entity that they recognize. Even in Syria, in such a civil war situation, WHO can only work with Assad regime. They cannot with the rebel group. And so in WHO's operation, when they can work with Chinese government, they cannot work with Taiwanese people. So that's why it's a political organization, they cannot criticize Chinese government. So when they do the investigation in China, of course, Chinese government's opinion or Chinese government position will heavily influence what they can tell the world.
Coming up, the Chinese New Year holiday has ended. Xi Jinping forced the business to open. Could that cause a second wave of the outbreak? China's extended New Year's holiday officially ended on February 10th. The 174 million migrant workers from rural regions are supposed to go back to work at that time. But the coronavirus epidemic has stymied domestic travel. Buses, trains, and planes are still severely restricted. Migrant workers are being asked to quarantine themselves for 14 days after they return. Most companies that can function with staff working remotely have told employees to work from home. The whole country is still partially shut down. However, one person is not happy with the situation. According to Reuters, after reviewing reports on the outbreak from the National Development and Reform Commission and other economic departments, Xi told local officials during a February 3rd meeting of the Politburo Standing Committee that some of the actions taken to contain the virus are harming the economy. He urged them to refrain from more restrictive measures. Local authorities outside Wuhan, where the virus is thought to have first taken hold, have shut down schools and factories, sealed off roads and railways, banned public events, and even locked down residential compounds. She said some of these steps have not been practical and have sown fear among the public, according to two people familiar with the meeting. Xi is obviously worried about the economy. The Politburo Standing Committee stressed the importance of keeping people employed and strengthening policies to support small to medium-sized businesses. But will sending a big portion of the population back to work cause a second wave of the outbreak? Here's what Lin Xiaoxu has to say.
Yes, I seriously concerned that this might trigger another wave of outbreak inside China. So on one recent report by Dr. Zhu Nanshan, the leading expert of disease prevention in China, and in this report he mentioned, so among 1,000 patients, 1,000 people infected with this novel coronavirus, and the mean age range for these patients is actually only 47 years old. So that means a lot of the young people, a lot of adults, they are actually got infected. This is very different from the seasonal flu. Usually you see, kids and then, senior people got infected, right? So that means a lot of young people become infected with this virus. So for people who go back to work, and so majority of people are, within this age range of 25-year-old to 60 years old. So they are can easily to become infected by the virus. So that's why it's a huge concern. And if Chinese government, under the economic pressure, they have to let people back to work, at least they should have additional measures to help people prevent the infection. But right now, it's just like many of the region, under the political pressure, under the government order, they have to resume back to work. That's why it's very worrisome, and many people don't even have enough supply of masks. So how do you prevent another outbreak in other cities in China? So I'm worried a lot about this decision.
The coronavirus epidemic has not yet shown any sign of winding down. A recent survey conducted by Tsinghua University concluded that about 85% of small to medium-sized Chinese companies can survive for only 3 months if they can't resume work due to the epidemic. Will China's economy crash? Will China be hit with a second round of the outbreak? Or will both or neither of them happen? Stay tuned. Zooming In brings you insights into the epidemic you can't find anywhere else. I'm Simone Gao. Thanks for watching and see you next time.